Hello everyone, my name is Sneha Danole from Risang Training Institute, and I'm going to share this technical video on the role of medical coder in healthcare professional. First we see what is medical coding. In medical coding, we use the accurate specific code that gives the information or that converts the medical records of that patient into the code form. And medical coder is the specialist in coding that was responsible for assigning the medical codes to the diagnosis procedures and services that was provided to the patients. And this code must be accurate and consistent, so we have to use that code in billing, insurance claims and reimbursement for. And this data also useful in these codes are useful in data analysis also. The role of medical coder is to firstly review the medical records that was given, and we have to assign the codes according to the classification system such as ICD-10, which is the international classification of disease, 10th revision of clinical modification, and CPT code, which is a current procedure terminology. This code, according to this classification system, we use the code after review of the medical record. Then first of all, it is mainly used for the reimbursement purpose, reimbursement for services. And second one is the it also used as a data used in data analysis, because in data analysis we have to track the record of healthcare. That's how we can use the that's how we can gives the healthcare policy, according to we gives the healthcare policy decisions. And there are also we have to there are also responsibilities of medical coder. First is to review, after giving that medical record for the assigning the code. First, medical coder review that patient record and identify the diagnosis or procedures and services that was provided, and also identifies the terminologies that we have to convert into the codes. Then second one is we have to use the code according to the classification system that fits that services or diagnosis symptoms or any kind of services provided that time. Then third one is sequence code correctly. We have to ensure that the code that was assigned to that procedure or services that was correct. And for checking that correctness, we have to follow some guidelines. And for guidelines, we have to or the medical coder should be stay up to date. That's how he can follow that guideline, and according to that gives the code that was accurate. And also matches the guidelines that gives the accurate consistent data or the codes of that patient's medical record. And medical coder also maintains that data. That's how we can gather the information about the services in a form of codes, uh, uh, or also from the electronic sources. There are electronic sources that's we can store that data into the short form, short codes. And when we require that data for the billing purpose, then we can gather or we can uh, recollect that large amount of medical record into the code forms. And the medical coder should be qualified personnel that was having a certificate or having a degree in medical field. That's he know about the medical terminologies or the um, human anatomy and physiology. Then also having a certification, that's he was certification such as CPC. CPC means Certified Professional Coder, and CCS, which is a Certified Coding Specialist. From this certification, he has certified that he gives the accurate coding to that medical record. Then the medical medical coders should also give the attention to the details that was present in records. That's how he can communicate with different kinds of conflicts that was faced in during the review of medical coding or assigning that medical codes to that services. Then this medical coding system are mainly medical coders are mainly responsible to give the code that was assigned to the medical records of that patient, and it mainly useful for the billing purpose and reimbursement, and also useful for the insurance claims also. That's all. Thank you.